Hi, my name is Sapphire Jackson, and I have PCOS.
Hi, I'm Hot Mess, and I have PCOS. I'm a stand-up comedian.
My name is Dr. Richard Markowitz. My title is Doctor of Medicine. I'm also a clinical assistant professor at the Hofstra University Medical School.
I was diagnosed a few years ago, and I just remember the feeling of hearing those words that you have a syndrome. And it didn't really hit me at first. The doctor gave me a bunch of papers to read and brochures and things like that, and I pretty much just took the brochures and threw them in my glove compartment and drove off. I didn't really pay much attention to it, but I remember looking in the mirror one day and seeing a lot of changes in my appearance. I noticed that my hair was falling out. I was starting to get like little skin tags on my body. And then I started getting this very strong and severe abdominal pain close to my pelvic area. And I just kept saying, oh my God, what is this? What am I feeling? Not really noticing at the moment that this was the symptoms of PCOS because I didn't do the research in the beginning.
The symptoms of polycystic ovarian disease can vary quite a bit depending on women and depending on, genetic predispositions. But the main symptoms that you see are things that you would normally see with testosterone production.
I could honestly remember when I first got pregnant in my early 20s, and I was excited. Told my mother and told, my significant other, like, listen, we're having a baby. So shocked because it didn't really happen all the times I did have unprotected sex. So it was like, okay, great, I can conceive. I think 7 to 10 weeks miscarried. I could say for the first time in my life I was speechless. But overall, it was okay. We could still try.
So when a woman has polycystic ovarian disease and she's producing really less estrogen and more testosterone, it's creating an environment that's not really helpful, if you want to call it, or suitable for production of a fetus.
Then I end up getting pregnant again and nervous because I got miscarriage. So but I took it easy, took it slow. I was pregnant, I'm happy. The first sonogram I had, and the doctor said, do you see this? And I seen this big old, grapefruit looking circle. I was like, oh, that's the baby? He was like, no. I was like, that's not the baby? He was like, no, that's your ovary.
I remember going to the dermatologist and they prescribed me minoxidil, which for some of you would probably know it's Rogaine for women. And I spent $35 on this little bottle, and I go home and I'm staring at this bottle trying to figure out if at the age of 24, 25, going on 25, if I want to start using women's Rogaine. This is something that I didn't think that I would face until my 50s, 40s at least, but not in my 20s. I then tried it, and my hair started falling out even more. I started getting hair on my face. I immediately stopped the Rogaine, and it was disappointing because I had a male dermatologist, and I felt like instead of him really listening to my issues, they just prescribe you whatever just to get out the office.
Going through the pregnancy, we went to do the sugar test, I call it, and I got gestational diabetes. I just got off surgery and now I have gestational diabetes. Now I gotta pick my food out and be on a diet, and this is when your time you're supposed to be able to eat.
The other big problem with polycystic ovarian disease is that women get this type of what we call truncal obesity, and they have a higher predisposition to diabetes. And a lot of times we treat them with glucophage, which helps to reduce these risks. But in general, polycystic ovarian disease in many cases is not treated, except for the things that it affects.
Had the baby early, a late preemie. Cool, baby's all right, healthy. We're happy. Then go to a annual, and he goes, by the way, you have PCOS. Okay, what does that mean? I don't know. Okay, and walks out the door.
I have my good days and my bad days. With the PCOS, I'm very emotional some days. The hair problem is definitely something that bothers me. I'm concerned about my kids being teased, if I do go bald, because that's how I feel. It is male pattern baldness. That's what they call it when you start losing your hair with this syndrome. It's very scary.
Women and men produce hair in the same areas in general, but women have usually less of it because they don't have as much testosterone. They have estrogen. So you'll see women with mustaches and even little beards and hair in areas where they really shouldn't have hair.
So I went about my life. I went back on the pill, and just as always, I was always on the pill, so I'm good. But financially, I had to downgrade my birth control, and I started noticing with the new birth control that I'm getting more facial hair, and my acne is here. I'm getting acne. Okay, no problem. Then I couldn't be on the pill at all, so now I'm starting to miss my period. The acne is now on my chest, and it's on my back, and it's on my face. And I have hair growing places I didn't even know it could grow.
The support really wasn't there for me. And I'm not saying this because I want anybody to feel sorry for me, because I am stronger because of what I went through. But if you don't have the support, it makes it worse.
Looking on the internet and people being PCOS aware on Facebook, and I was like, oh, I got that. Oh, she got that too. Starting to research it, because now I'm like, I have this adult acne. I'm doing everything. I'm going Clearasil, Neutrogena, black soap, and it's not clearing up. So now I'm going in and I'm doing research, and I'm like, this is PCOS? And the doctor just said, oh, by the way, you got PCOS? Like, really? So I had to educate myself.
It's tough. I can't even express to you how many nights I just cried, just like asking God, why do I have to go through this? But I know that it is a learning experience, and I'm going through this for a reason. He wouldn't put more on me than I can bear. I know that, so I try to stay strong.
My GYN, and I understand my GYN is not his job because he's the GYN, but you could have gave me a little basic. My primary physician, I told you what I had. You still should have gone into it. She didn't. So now it's on me to find out how to eat, what to do, and now it's my problem. So I'm just moving forward.
Sometimes I do get angry because I feel like if I was diagnosed a lot sooner, maybe certain side effects I wouldn't have gotten as heavy. Like when I talk about my hair, it's something that's really emotional for me, because as a woman, you like to have nice hair. Your hair is a part of your appearance.
I think a lot of women really don't know what it is, and so the education process, I think, needs to be better addressed. And once a woman can look at it and say, why is this happening over here? Maybe there is something going on here. And getting to a doctor who can make the diagnosis, I think that's going to be helpful.
Conceiving, is it possible for me to have a number 2? I don't know. because now I'm going through, I'm not ovulating, I'm not menstruating, but I have these moods going back and forth thinking, oh, you're a woman, it's okay to have mood swings, but now I'm depressed, not knowing it's my PCOS that's causing all of this. By the way, you have PCOS.